All right, guys, welcome back to another episode of the Battles Nonsense podcast. I am with Brittany Holcomb, CEO, owner, operator, injector of the Skin Refinery, and we are going to dive into all things filler, aesthetics, skin, all the things. So stay tuned. All right, guys, I drove all the way up to Fayetteville, Tennessee. It's really not that far. It's like 35 minutes from my house to see Miss Brittany.
Hey,
hi, Brittany.
Hi, thank you for having me.
Of course. So I obviously have done filler podcast in the past. I have had a doctor's point of view, a physician's assistant's point of view, and a nurse's point of view. And I wanted you on the podcast because you have done a lot of corrective things for me. And you're also a nurse practitioner. So it also gives another level of expertise and just a different opinion. Mm-hmm. So I appreciate you letting me interview you.
Mm-hmm. Glad to be here. Yeah.
All right. So you currently are in Fayetteville, Tennessee. Mm-hmm. Nurses and nurse practitioners are allowed to inject there. So that's why we have to drive to her. She cannot come to Alabama. For those listening to my podcast in Huntsville, it's not that far. It's like a 35-minute drive. But I wanted to dive into your backstory a little bit and how you became interested in this world of aesthetics, if you would, from becoming a nurse to nurse practitioner, and now you're into the aesthetic world.
Mm-hmm. Yeah. So my nursing career has taken me so many different directions. In 2013, I was interested in aesthetics. I took a course in Nashville, but then I went on to get my bachelor's and just sort of lost track of it. Went on to get my master's degree later on, and turns out that our industry is saturated here locally. So I branched out and started looking more into aesthetics after doing a little bit of primary care for people without insurance. So I did that for a little while and then started working at another location and just really fell in love with it. And I felt like I was talented at it. So thought I would pursue it further. Was pretty unhappy at my last location. So I decided to branch off and become an entrepreneur on top of that.
So how did you how did you know that you were good at aesthetics? Like, I think I'm good at it, but I also know how picky I am. And I don't think I could be good because I would think I would never be happy with the results.
Because you're a perfectionist. Yes. So, but that's required. That's a job requirement. Symmetry is beauty to a lot of people. So you have to be a perfectionist and deliver what people expect. So, how did I know I was good at it? That's a really good question. I didn't think I was good at it at first. I felt like I could see what I wanted to do, but I didn't know that I could deliver on how to get there. You know, when you look at someone's face and you think, okay, I see what needs to happen, but how do I get there? So that just took experience, time, lots of training and practice. Luckily, the practice end of things went well. You know, I've always delivered what I feel like to be pretty great results. But now I really have it really honed into what I want to see. It's gotten so much easier for me, I guess. And that's just experience and doing it over and over and seeing people after they've healed and thinking, oh, you know what? I would have changed this, or I should have done that differently. And those small tips really just, they made me a perfectionist.
Well, I mean, that's with any career, right? Like when I first became a nurse practitioner, even though I had been a nurse in the ER for 5 years, my first day as a nurse practitioner in the ER, I was like, I don't know what I'm doing. What am I doing? And,
and
they were like, Johnny, you've literally worked here for 5 years.
Yeah. And even, you know, like even now I see things and I'm like, man, what do I have to do? And you know, you think of all your options. And now I feel like our practice has expanded so much that I have added lasers on, and I have Leslie here and she does PRP and, you know, semi-permanent makeup. And so now we have all the tools at our disposal to get to the results that we want. And it's a matter of navigating through those options and making sure we can deliver natural conservative, because that is definitely what I want to do. I want to restore.
That's what I was going to ask you. Like, you do more of a subtle enhancement, like natural, where a lot of people, and which is fine. That's what they like to do. Like, that's what they want to look like. The Kylie Jenners of the world, they want to be like, I want people to know I have filler. I'm the opposite. I don't want people to know I have filler, but I'll tell you I have it.
Same. And, you know, they tell you can choose your injector based on what they look like, you know, because that's what we find to be attractive. So that's usually you're going to inject in the same style or manner that you find attractive. So for me, I like a natural conservative. I want to look like I'm in my 30s. I just want to look like a graceful 30-year-old.
Same.
Yeah. And it's intimidating, you know.
So we're going to talk about a little bit of the products you carry because they're different from other injectors that I've been to in the past. So when I came to you, you had to correct my lips that I had gotten done elsewhere in Tennessee, not in Alabama. And you had to correct them because it's not that they were bad. They weren't the way I wanted them to look. I wanted them more subtle. I wanted them more natural. And so we had to use Hylenex to dissolve them. So kind of tell us or talk us through how that procedure, if someone does come to you and they're like, hey, something's off with this, I don't really like it, and you have to start over, because I know people are scared to dissolve their filler.
Yeah. Okay. Yeah. So we've dissolved yours, 3 times?
Yeah.
3 times?
Or more.
Yeah. Yes. So filler's not, it is dissolvable, but it does take time. And unfortunately, it can take more than one time, but we use just 1 vial of Hylenex at a time. It's an enzyme that breaks down the hyaluronic acid filler. So sometimes you don't need to break all of it down. We just need to get you back to a point where we can reshape the lips, I guess you would say. But you don't be intimidated by it. We try not to use it a whole lot because we don't want to change the tissue either. It's really just there for people who are unhappy, or if you've had filler for a long time, it just builds and builds and builds up. So it's normal after so many years to have to dissolve that.
I was about to say, I've been getting my lips done since 2017 when I moved to Nashville. So I just think over time and then different injectors techniques. And I have very small lips anyways. So I'm just assuming with the research I've done talking to you, it just started to migrate and you had to fix it before. And I appreciated that honesty. And that's one thing I love about you is you're so honest. And you were like, I'm not feeling over this. Where some injectors will, because that's what people are scared. Like when they hear we got to dissolve this, it's like, but I paid all this money and then I'm going to have no lips if I dissolve this.
And it's expensive to dissolve too, right?
It is.
It's an investment, yes. But I feel like if you're unhappy with your lips and you dissolve and you get back to baseline where you want to be refilled, it's so much better.
Oh, it is.
And the longevity, lip filler lasts longer. The companies will tell you 6 to 9 months, but what I usually see, people who just want to maintain their youthfulness, really close to 9 months to a year. About once a year, you can budget for that.
And I appreciate it. Again, like you're so honest, where you may have some injectors where I have had friends go elsewhere and they're like, yeah, they tell me to come back every 6 months. And I'm like, your lips literally have not changed.
It does. And if you stay hydrated and you don't, if your lifestyle factors make a big difference too. So it lasts a lot longer.
And I've noticed, or you mentioned to me, so when we refilled my lips recently, a couple months ago, maybe a couple months ago, then we did it slowly by little because I have a very difficult lip, I guess, I feel like.
Beautiful, but yes.
You used Versa products, and I've always gone to injectors who use Juvederm, and I can tell a huge difference in the Versa in my lips. I feel like it's more natural, it's subtle. So tell us a little bit why you chose Versa over the Juvederm.
So I started out using Versa, so obviously that made me feel a little bit more comfortable with it. But a lot of people have trouble with Juvederm. They have the delayed onset nodules, or they just have nodules in their lips. And all fillers have a different texture per se, where they're cross-linked or they're not cross-linked, and they have these different fibers in them, and those can sometimes cause nodules. So, there's a lot of different products on the market, but Versa is just so reliable. It's consistent. It's soft. It's moldable. I've never had a nodule with it. So I just thought, why change it?
Yeah. And if it's working, why change it? So would you say it's less, there's less ability for that to migrate? Like I know when I've read, like they say that Juvederm can migrate more because of maybe the molecules or the consistency that it is.
So that I'm honestly not sure about. So I won't answer that because I'm not sure. I don't want to tell you wrong. But I think migration happens for a couple reasons. First, if you inject too much at one time. So that's why I love the Bestie syringe. That's where I do a half syringe. And I absolutely love slow building. I think the results are better instead of just, doing a huge amount in one day and then you swell terribly. I love that. So migration. You can inject too much at once and force it out of that dermal layer into the tissue surrounding, or it can just be from building and building and building. Yeah. So too much, not even too much, but just building over time. You can accumulate too much product.
And then it just kind of goes outside that layer. Okay. I mean, that definitely makes sense.
And then there's a few rules after you get lip filler. You can't purse, kiss for 48 hours. And that's important. They're finding in new research that actually matters and it can cause migration.
Oh, wow. Okay. Because a lot of people think, oh, these are just guidelines, so I don't have to. And what she means, like something as simple as like leaving your filler appointment, getting in your car and not drinking out of a straw in your water bottle, which I'm huge at like doing that. But ever since I've had the issues and came to Brittany, I was like, I'm going to follow every instruction to the T.
The rules. The rules are there for a reason. And I can't tell you how many times I say this. No pursing, no kissing, no straws. Like, it's just habitual at this point.
Yeah. And so not only do you use Versa products, which I have come to love because I think that my lips look way more natural than they did. And whether that be just because you have a great skill in injecting, or it's the product, or both, or all, I think there's a combination of all of that.
So touching back to migration, another issue is technique. So if you pierce through the vermilion border, you've given the filler a place to migrate. So you have to be careful where you inject so that, and technique does matter.
Yeah. Like go into a skilled injector and not someone off Groupon that's saying, well, if you come to me.
Yes. Do your research, look at your before and afters. And I love posting healed pictures. What does it look like when it's healed? Sometimes it's deceiving on Facebook or Instagram when you see those immediate results. But what does it look like 2 months later?
Yeah.
Show us that.
Yeah, that's because you're exactly right. I had someone point that out to me that was going to injector school. She was like, always make sure when you're doing like before and afters or looking at before and afters before you go to injector that they're making sure they actually post the healed picture because lips, anything can look good right after.
I post a ton of immediately after, and that's just convenience because people are here. But I love catching people a month or 2 months or even 3 months after we've done filler.
Yeah. Now, another product that you use that I wasn't very familiar with is Xeomin. Am I saying that correctly? Xeomin. Okay. And that is just another form of Botox. Well, but you explained it a little bit different to me on something I didn't know on a molecular, I guess, biology level. So explain that to the followers on how and why you like that product a little bit better.
Okay. Yeah. So you have the three main brands. You have Botox, Xeomin, and Dysport. Botox is the oldest molecule out there. That's why we all know it. Botox was the first one to come out. And the technology's just gotten a little bit better. It's an old heavy molecule. And so Xeomin took off the accessory proteins. So they took off the accessory proteins, and that means that your immune system doesn't see it anymore. So when you inject the molecules that have these proteins on them, your immune system sees it, builds antibodies to it, and then breaks it down. So theoretically, over time, you can build an immunity to it. So it doesn't work as well and it doesn't last as long.
Is that why my Botox so I had to alternate between Botox and Dysport. Like I would use Botox for a long time. And then I'm like, this literally lasts a month and a half. And then I went to Dysport and I was like, okay, it's back to my 3 months. But now Dysport is even not lasting as long on me.
Yeah, so it can be. And certain toxins, people respond differently to. So some work better for others. And, I carry Botox and Xeomin. And then there's a new one, Daxxify, that we had mentioned was just FDA approved. So it is supposed to last 6 months, but there's a little secret to that, and that is dosage. So dosage equals duration. So if you want toxin to last that long, you have to consider a couple things, right? You have to consider, what if my brow's heavy? Do I want that to last for 6 months? So
and you can't reverse it. It's not like a filler that you can dissolve.
So there's a few things I'm going to have to do a little bit of research on as far as that goes. But the new technology is awesome. I'm excited to hear about that molecule as well.
Yeah, I mean, because then if there is this antibody production and they have it in theirs, will it last 6 months?
Right.
Because Botox is supposed to last 3 to 4, right?
Right. One of the other new ones, it's identical to the Botox molecule. So
you may get like immune to it a little bit.
And
okay.
It may not be any better.
Well, and then price point's going to be just double your, like you said, if it's dosing, and then it's just going to be double your dose. So you're really not getting cheaper. Because it kind of sounds very elusive, if that's the word. I don't know. I'm terrible with words. To do that. And you're like, oh, I only have to buy Botox twice a year. But then it's like, but really, it's still the same price point.
Right. And I always think it looks better, but that's my style. I like the natural style. I dose myself every 2.5 months, a light dose. And that's just so I can raise my brows and I have plenty of movement without being frozen. I don't want the top half of my face to be frozen and then the bottom half still move. So
mine does that because I'm horrible. I have a huge forehead.
I like a little bit of movement.
I don't know. I don't know if I do or not.
And not everyone does, right?
Like I do. Okay. I do like a little bit of movement, but I also want myself frozen. Okay. So I don't know how you do.
Cannot have both. We have to choose which one.
I do like where my brows can move a little bit. I just don't want, I guess what I'm saying is those little bitty wrinkles. Yes, the little bitty wrinkles when it starts doing that, like when it's wearing off, I'm like, freeze it.
And so that's why I'll dose at 2.5 months. I'll start to move again, and I never let it get back to even 75% movement. Once I'm at probably 50%, I'm redosing.
Okay.
And skincare is important too.
Yeah, we were
hydrated skin.
I was about to say we were going to dive into skincare as well, because an injector can only do so much, and there's like we were talking about with the filler post instructions and even Botox post instructions to not go to the gym within 24 hours. And if I got Botox at your place at 2 and then went to the gym the next morning at 5, I'm not following the rules. So skincare, like, you have to kind of do work at home as well, right? Like you're doing filler, you're doing Botox to help that anti-aging. So kind of talk about the skincare line you carry and what you like recommend. And I know you have a lovely esthetician and things like that you offer at your place.
Yes. So we carry Environ. The main reason we carry it is because you can use it all year long. So you can get your vitamin A. Your skin's not going to be dry, inflamed, irritated, flaky, none of that. It's a slow step up system. And it was created by Dr. Des Fernandez, who invented the line to prevent skin cancer.
Oh, wow. Okay. I didn't know that.
We have a lot of sun exposure. We're in Tennessee, and we need a product that can protect our skin year round. So it's
now, when you
simple.
say vitamin A, is that a retinol? Okay. Because I get confused when people say vitamin A and then other people in their line say.
Yes. So vitamin A can be broken down. So retinol is a stage of the process of breaking it down. Like tretinoin is even more broken down.
Oh, okay.
So this molecule is called retinol palmitate. It's in a lipid molecule. So it's hardly broken down at all. But that's what is stored in your cells in your skin. It's 60% of the vitamin A in your cell is retinol palmitate. So when you go out in the sun or you have environmental factors that your skin needs to protect itself from, your DNA has it at its disposal.
Oh.
But versus if you use tretinoin, that's all the way broken down to retinoic acid, that's what your DNA is going to use. Tretinoin is not quite there, but it's broken down farther along in the process. You only absorb about 2% of that, and you don't store that in your cells. So the reason why it irritates you is because it's in an alcohol or acid base. So retinol palmitate is in a lipid base.
Very interesting. Yeah, I did not know that. So that's very interesting. And I know you said this line is tried and true. They're pretty good with their products. So again, it's all about what you do at home as well as what an injector can do. That's just like if you go to the doctor and they tell you that you need to do these things to lower your blood pressure.
You have to work out.
You have to do it. You have to do it.
You have to go for a walk. You have to eat healthy. At-home skincare is the basis. It's the base of the pyramid.
Yeah.
SPF and skincare. And yeah, Environ's sold in 70 countries. So it's huge.
The more you know. They say you learn something every day. I just learned this today on the podcast as well. Now, you have another little product that I want to touch on because I didn't know about it until I met you, and it's called Radiase. What is that and what does it do?
So there's different types of filler. You have your hyaluronic acid filler, which is what everyone knows. That's your Juvederm, your Restylane, Versa. Most fillers are HA fillers, but Radiase is made of calcium hydroxylapatite. So unlike HA fillers, which is hydrophilic and draws water up to the area, Radiase does not. On top of that, it stimulates collagen and elastin to grow by activating your fibroblasts. So you get 2 perks of it. You get an instant fill with the product, but then over time, you're stimulating collagen and elastin, which is part of why we have the deficit in the first place. Is just we lose collagen over time.
So is it is a filler?
It's a dermal filler. It's actually it has the highest G prime, which just means that it's the thickest filler of all, which is another thing that's really awesome if you're trying to build jaw lines, cheekbones. It it's like a bone. It's calcium, which is what your bones are made of. So you can give a nice sharp contour without puffiness of an HA filler.
Now, I guess is the biggest difference maybe so that everyone should know that hyaluronic acid fillers are the ones that you can dissolve. So Radiesse is you cannot
dissolve it.
So make sure you're going to a very skilled injector with that.
Skilled injector. And of note, any filler that lasts 2 years is cross-linked. So it's going to be very hard to dissolve anyways. So, there are safety measures that we follow, but,
yeah, I get what you're saying, but, I just wanted to make sure that people did know that because back in the day, people were using silicone as a filler.
Everyone's doing it, yes.
And so I just wanted to make sure people know that there are fillers that you can't dissolve versus ones you can.
Right. And it's not permanent like silicone, right? This one lasts about 18 months. But the benefits from it, so I can use it as a dermal filler to fill spaces, cheeks, chin, jawline, or I can use it for skin tightening, which is incredible. I can put it under the dermal layer to stimulate collagen and elastin to grow. And it can last 2 to 3 years because it's just your tissue. It's not the filler that's there. It's the tissue that you've grown.
And you can use this other places that you can't use, like the hyaluronic acids, right? Like, is it the hand, like the back of the hands, or you can do that with hyaluronic, but like, did you use it on someone's stomach?
But yeah, let's talk about that. So if you put HA filler in the back of your hand, all you've done is filled the space. You're not going to get any collagen or elastin growth. So once it's gone, it's just gone. The product is gone. It's metabolized out. But if you put Radiesse there, you're going to grow new tissue. So as long as you protect it, wear SPF, don't smoke or indulge in environmental factors important. Stay hydrated, then that's going to last you 2 to 3 years. So your longevity is going to be much better with tissue that you grow versus just something to fill the space.
That's amazing. And who knows what they're going to develop in the next 5 years to help all this aesthetic treatment anyways. Going back to my lips, I know we're jumping around, but that's the point of the podcast. That's why it's called Babbles Nonsense. I wanted to talk about PDO threads. So I have mixed reviews.
That's okay. A lot of people do.
Now, you put some PDO threads in my lips because of the migration issues I've had in the past and from the past filler I had with other injectors. And I am very happy I did that. So thank you for talking me into that.
Yeah, you're welcome.
It definitely christened up the border because I didn't really want them huge and big. I just really wanted a crisp shape around my Cupid's bow. And you did that and it's amazing. So kind of talk about how you do PDO threads. The only ones that maybe and I think it's just because I've listened to other people in LA and things, the ones that have the barbs on them, I've heard plastic surgeons, like the ones that go in your face, like they sometimes have to surgically remove those. But again, it's all about technique in the injector.
Training. Yes. And what type of product are you using? I use PDO Max. I think they're the best on the market. I've never had a problem like that ever. And I think part of it too is expectations and who's a good candidate. Not everyone's a good candidate because it works mechanically. So if you have a heavy lower face, it's not a good treatment for you because it's not going to hold. So you have to make sure it's the right person, and technique is important.
Would you say the right person might be someone who, they're just starting to age, they're noticing it a little bit, they definitely don't need a facelift, so they don't have the excessive skin, all that stuff, so that's kind of like the perfect candidate, that in between?
Correct.
Okay. Now, would that help prevent getting a facelift later on?
So a few things happen that is why you need a facelift, and those are things that I can't do. Our ligaments are going to displace, fat pads are going to displace, the skin's going to sag. So I almost consider myself a middleman for trying to get you to the facelift happily. You know?
Or just prolong it so you're not having to get it as early.
Yeah. And if you don't want a facelift, you just want to age gracefully, I can do that too. But there definitely are limitations with them. But it's just there's a select few, there are very good candidates for PDO thread lifts, but the barbed threads that you're talking about, those are for lifting.
Okay.
What we put in your lips are smooth threads. That's for everyone, really. You can put it in the glabella for the 11s to build collagen, because I personally do not put filler in the forehead. Just, it's a risk. I leave that to plastic surgeons. But in the lips, it does create a nice border. It stimulates collagen.
I love them in my lips. I'll definitely do that once a year, like you suggested, because I just think that it just made them very natural and pretty. And I think what I like when people have filler is like they look at you and they go, do you?
That's my ultimate goal. That's what I live for.
Yeah,
yes.
Like, and I've had people, like I was getting a massage or something and I was laying there like face up and she's massaging my neck and she was like, I know this is like something you're not supposed to ask. She said, but your lips are just so pretty. Are they real? And I was like, no. I was like, they're not. But I can tell you where you can go.
That's the ultimate compliment because we just want to restore. We're not trying. And there is a population that likes the bigger lips and more filler. And I can do that, but I just prefer that it's not the style that I like.
Yeah. So speaking of surgery, I have not spoke about my surgery yet. At all on the podcast, and I wanted to save that for you and I to talk about.
I'm honored
because I know that when I was coming to you to get my lips dissolved, I was right before I was having surgery, and I haven't talked about it because I was embarrassed a little bit, and I didn't want anyone to get their feelings hurt, I'm just gonna go out. So I had a lower blepharoplasty with a cheek lift, and the reason why I had that was due to under eye filler from a previous injector a long time ago. I don't think that the technique was wrong or anything like that. I've spoken to plastic surgeons because it was something. So essentially I had under eye filler when I didn't need it. I wasn't a candidate for it. And it left this puffiness that wouldn't go away. I went and had it dissolved, and then I dissolved it a lot because it just kept coming back, which then caused the tissue integrity issue, which caused my skin to sag a little bit under my eyes and was very thin. And then there was nothing I could do. Like, I wasn't about to put filler back under my eyes. And I met with a couple of different plastic surgeons who definitely told me I needed surgery. And then I just waited and waited and waited. And I was like, okay, this is really bothering me. I'm going to have surgery. So a lot of people didn't know that because it was a very subtle enhancement. It wasn't like I was trying to change what I look like. I just had felt like I had aged at my age. And then, of course, when I tell people now that I've had surgery, they're like, there was nothing wrong with you before. And I'm like, well, it's not for you to decide. But I know that you saw my healing process, and we wanted to kind of talk about the, things that can go wrong with filler. And sometimes it does result in plastic surgery. So when we talked about it, like under eye filler, that's like the number one area I think that people get it that maybe don't need it. So can you talk a little bit about candidates who should get it, the filler that should be there, and things like that?
Yeah, under eye filler is really a last resort. Like you said, there's a lot of complications that can come with it, and sometimes it looks really good initially, and then later on you're like, wow, that does not look good anymore because you have edema. But I don't use a cannula. I know some people still do, but I use Bellatero in the tear troughs because it's the softest filler, and their technique that they teach you is without cannula. You want to go straight to the bone. And that's because if you put filler on top of tissue, you're either occluding something, you have lymph drainage coming out of your eye.
Yeah, I was about to say the lymph drainage.
And so if you take a cannula and you cross that plane, then you can sever that. And
that's what happened to me that's what the plastic surgeon told me. He said that my, what's it called? What's this? I'm pointing at it. Y'all can't see, but the this line that you sever, like
your ligament.
Yeah, like he said that the way because it was used with a cannula, like it severed my lymph drainage, so that's why it kept.
Yeah, well, if you think of like the lymph drainage in your neck, if you sever that coming out of your eye, that's it. I mean, there's not anywhere else for that fluid to go. It's just going to sit there. And the most common mistake that I see people do is they will put tear trough filler without supporting the midface. So most of the time, you don't need tear trough filler, just like you didn't need it. It's like, oh, I have this tiny little indention. That does not mean that you need tear trough filler. We always want to start with the midface because that's where we're losing fat pads. That's where we're actually losing tissue. So let's replace that and get it back to normal and then decide.
And that's what was happening. I was like working out a lot. I started losing weight. So of course your face, you lose fat in your face, and that's kind of what was happening. And it wasn't that I needed the filler, but I also don't think that the technique was wrong. I just think that I wasn't a candidate, and it kind of resulted in this situation. Now, I will say I consulted with a lot of plastic surgeons. There's this one guy in LA I wish I could have went to. He's an oculoplastic surgeon, and he is 100% a proponent of like not putting that there. That's a surgical area most of the time because like you said, it's more of a cheek mid-face thing. And if you correct that and it's still the eyes, then that is a surgical procedure. he actually does a lot of lectures on it and says that filler can cause this issue that a lot of people are having. But then I've also talked to other plastic surgeons who are like, filler can't do that. No, that's not a thing. So
yeah, I guess my perspective is I've seen too many bad results. Not for me. Want to be clear.
And you were not the one that did this to me either.
No, correct. But even myself, I have a septum that's falling down and fat pads are falling forward. And when you think about your options, it's pretty minimal, right? I mean, that's a surgical issue, like you said. So I will usually tell people if I'm going to soften that transition, I'm very upfront and honest. This is a surgical procedure. I will soften it for you. You know, if you don't want to have surgery, that's fine. I can try to get you through until surgery. But yes, very, very careful in the tear troughs. I do tear troughs, but it has to be, once again, like the PDO threads. You have to be a right candidate for it. And it is definitely not everyone. And a lot of people are really happy once you fix their midface, because that was really the issue to begin with.
And I appreciate you speaking on that. I get, so I'm trying to figure out, it's not that I haven't talked about my plastic surgery with people who ask. It's just I haven't done it publicly. Or like the filler. I used to a long time ago, like, didn't want to tell people I had filler. And I think it's because we learn from celebrities, like they don't talk about the things they do.
It's olive oil.
Yeah. It's like, but I think that if you're going to do something, not that you have to get on a podcast and publicly say, this is what I had done, but I think that it's misleading. It's misleading if I would have just walked out of your store today and someone was like, your cheeks just look really good. And I was like, yeah, Brittany just injected them. And then it was really a surgical procedure. And then someone else comes in and they're like, I want exactly what she had. And you're like, well, okay. You know, and I think it's also good to note that we're all different. Our facial structures are different. Our lip shape is different. And we take pictures off the internet, off Pinterest, or, you know, if I come in here with my friend and split a bestie syringe and I'm like, well, why doesn't my lips look like hers? And you're like, Jonna, you don't have the same shape as our lips. I can't change your shape.
That's what I told you.
And I think that's a thing that we don't think about when we're getting procedures or injections. We don't think about like my anatomy is not like hers.
Yeah, we can only enhance what you have. But on a side note, your surgeon did an excellent job.
Oh, thank you.
Your cheeks look fabulous.
Thank you.
And he saved you a lot of radius. So I think it was a good call.
Yeah, I'm super happy I did it. I just haven't spoke out about it other than telling people I've had plastic surgery. But I mean, that's another podcast that I've done previously is why is it acceptable to like have a breast implant? And it's acceptable to do BBLs, but as soon as we do something to our face, everyone's like, oh, you're just trying to change your looks. Well, bitch, so is everybody else with their breasts and their ass.
Yeah.
But why is that acceptable, but your face isn't?
Or your beard.
Yeah. Okay.
Right? What are you hiding with your beard?
Oh, yeah,
I'm just saying, men can grow a beard.
That's true. That's very, very true.
Yeah. I think so when I first started doing this, it was like, I felt judged even by my family, you know, like, I can't believe you're doing aesthetics. And now I feel so empowered giving this to people. Like what I give them is their confidence, and I don't really care what anyone thinks about that. And the thing is, people who say that, you can't tell. If you look at my patients, you should not be able to tell what they've done. I'm just restoring a youthful look. And even if somebody's doing it, even if Kylie Jenner wants to do that, that's fine. That's her body, you know? So yeah, I hate that stigma. I do think it's going away though.
It is. It's getting better, especially in the South. Because when I first got my lips injected, it was in 2017 when I lived in Nashville.
Was it a big deal?
No, because I lived in Nashville.
Okay.
But then I moved back home and then I was like, well, I need to find another injector. I need to do this again. And as soon as I did it in Huntsville, just an hour south of Nashville, everybody's like, you did what? Like you got your lips done? I said, bitch, they've been done. They've like you just didn't see me for a year.
You loved me when they were done. You just didn't know.
Yeah. So I just think that's amazing. I know you've brought on some new services recently other than the aesthetic stuff. So now currently you have brought on a weight loss injection.
Yeah, so we are offering semaglutide. I'm really proud to offer that. I'm hesitant to do weight loss and hormones and that because I love skin so much. I don't want to be busy doing other things. But the weight loss, actually, I went to an erectile dysfunction class with Leslie, and there was a company there. And, you know, Wegovy, Ozempic, those are all semaglutide. And if you do not have insurance, it's $1,100 to $1,200 at the pharmacy. Really so if you do have insurance, sometimes they'll pay for it, and it will be a $25 copay, you know, with their coupon card, which is awesome if you could do that. But all means do it. So I'm kind of a middleman. I offer it, and I was able to get it for $250 a month, and it's a white glove service. People inject it at home. I see them once every 3 months, and it's been really great. But I'm proud to be able to offer that to people and make it more affordable.
And I think that you're doing it the correct way, because you do have the medical background and the knowledge, the nurse practitioner side of you, where some of these people are getting online to these doctors just to get it, and they don't need it, or like, what's the long-term effects? What's going to happen when you stop taking it because you can no longer take it? Like the research, and I know you're a research-based nurse practitioner, and I love that about you. So I know you're doing it safely. So I love that you're offering that to people, because it's also along the aesthetics line at the end of the day.
It is, and it's so healthy. You know, our weight really matters, not for aesthetic reasons, but just for our health. So I want everyone to have the ability to access that. I hate people who can't access. I hate it when people can't access medications. There's no need for that.
I 100% agree. So do you have any anti-aging secrets other than anything that we talked about?
Just remember your pyramid. Skincare. Start with skincare, and then, it is going to require a neurotoxin and fillers at some point if you want to go that route. And if not, just avoid the sun. Don't smoke, avoid the sun, and drink a lot of water.
Those are great tips. One question I didn't ask you earlier in the podcast: how did you come up with the name The Skin Refinery?
Ooh, this is so fun. So I was at the beach with one of my best friends, and we were like, I just kept thinking of an industrial mid-century feel, and the word refinery just kept coming up. And so I was like, that's it. It's going to be the refinery. And in my mind, my logo was going to be sort of like pipes and very industrial. But then my husband was like, nobody's going to know what the refinery is.
Sounds like a cool bar.
And I was like, you're right. That's so true. So then he goes, what about the Skin Refinery? And I was like, bingo. That's the one. Yeah. So
it wasn't that hard for you to find out a name? It just came to you?
Yeah.
Oh,
we were just,
and then it was born.
Brainstorming. Yeah. My best friend Rachel and I I owe her part of the credit.
Oh, that's sweet. And I know that you just brought on, like you said, the new, the erectile dysfunction, that you're doing, the weight loss. You've been doing neurotoxins and filler. Is there anything else you want to bring on in the near future that you can give exclusively to the podcast?
Yeah. Well, we just bought a laser. So that is.
What did you buy?
That's going to complete our practice for a while. We have enough going on. So we're going to leave it there, and we're going to just be experts at skin with a few side things. We do sexual wellness with the O shot, P shot, and then the weight loss. But other than that, we're going to stick to this. But lasering, yeah. So I bought a platform that has 5 different lasers on it. So I can do tattoo removal, laser hair removal, IPL, erbium laser, which is an ablative laser, which is great for sun damage, severe sun damage, or moderate to severe anyways. I think that's all. Yes.
Okay. Well, Brittany, I appreciate you so much for taking your time out. I know y'all probably heard a little bit in the background because we are doing this on the clock.
At work.
I drove up here and I was like, hey, do you got a little time on a Saturday? Because I know she was working, and she's super busy. And she was like, we're going to do it because we've been trying to do this for a while, and I appreciate it because I know your time is super valuable.
No, thank you. Yours is as well.
All right, guys, you heard it here, and you can always visit Brittany, and Brittany, tell everyone where they can follow you, find you, and how they can get an appointment.
Yeah, Instagram, it's _Skin Refinery, and then on Facebook, I'm there as well. You can either book online or give us a call, and our website is the-skin-refinery.com. You can book in any of those locations.
All right, thank you.
Thanks.
And until next time, guys, as always, bye.
Bye.